Hello and welcome everyone to this wonderful, wonderful evening. We've got a fantastic show for you tonight on the DEBAKEY CV Live Adult Congenital Heart Edition. My name is Huie Lin with the Adult Congenital Heart Program here at Houston Methodist, and as always I welcome all of you to join us online or via text message. If you want to send us your comments or your questions, please join us on polev.com, enter DEBAKEY and respond with your questions or your comments, or join us by text message by your phone. Text DEBAKEY, D-E-B-A-K-E-Y to 37607 and text in your message or your question. We have a wonderful show tonight where we're going to be talking about what your doctor needs to know on the outpatient level. And we have a bunch of fantastic guests, and we're going to cover a bunch of different topics from the very, very complex to the simple everyday issues that your doctor needs to know about your adult congenital heart condition and how you can relay that message and how that plays out in your care. On my left, I have the wonderful Dr. Diampera. Dr. Diampera, can you tell us a little bit about yourself?
Yes, good evening. So I am a consultation liaison psychiatrist. I've been working at Methodist since 2015. I see transplant patients and see quite a few patients with congenital heart disease that Dr. Lin has been managing, but primarily inpatient, and it's advocating for psychiatric care for patients with complex medical conditions with emphasis really on the improvement of quality of life.
Wonderful. Thank you so much for joining us this evening. And on my right, I have LiliRuth Stark. LiliRuth, will you tell us about yourself?
Hey, yes, sir. I am the transplant coordinator at Houston Methodist for all of the pre-heart patients. I take care of the adult congenital patients that are at the point in their journey where we are considering transplant, maintain them as a patient all the way up until the point that they're transplanted.
Fantastic. Yep. Thank you, LiliRuth. She's been really great with our team recently. And joining us online, we have Leslie Castro. Leslie, can you tell us a little bit about yourself?
Yes, I'm actually from Pittsburgh, Pennsylvania area. I'm 48, and I had tricuspid atresia, pulmonary stenosis, mitral valve regurgitation, ASD, VSD, transposition of the greater vessels. And I recently had a heart transplant in 2019. I received a Hep C donor heart from a 29-year-old intravenous drug addict.
Well, thank you so much for joining us. We are excited to hear your story. But before we get there, Kestly Tinklepaugh, would you mind introducing yourself?
Yes, hello. My name is Kestly. I was born with tetralogy of Fallot and also a right coronary artery defect. I have an identical twin sister who was also born with tetralogy of Fallot, and I have a 2-year-old son, and I have not had any surgical intervention in 25 years now.
Well, that's great to hear, and I'm very, very excited to hear your story as well. So let's go ahead and get started. So Leslie, you started telling us a little bit about your condition and about what you've gone through recently. Can you help us to understand what that's like today when you walk into your doctor's office and what those conversations are like?
In my general physician, I've known for 45 years. So he has basically been with me, other than me being away from Pennsylvania for about 20 years. But when we discuss about thyroid issues, any cardiac related issues as far as transplantation or such thing as CMV, I let him know. However, at the same time, my primary care is with the heart transplant team. So I always relay the information between him and the transplant team.
That's really, really helpful information. And Kestly, how about you? Tell us what you usually tell when you tell your primary care doctor when you walk into the office and how you guys communicate.
So typically, I'm only 27 years old, so I recently just got established with an internist with Methodist. I realized that that's what I needed. But usually upon first meeting them, I tell them about my condition, and then I get established with them. And yeah, sorry.
That's great. And then tell us, because you also mentioned that you have a son, tell us how that interaction went when you started talking to your obstetrics and gynecologic physicians.
It didn't go good. So what happened was I went to an OB in Tomball, and she wanted to deliver me herself at a regional hospital. And she told me she had a TOF patient before, but then I said, no, I can't deliver with you. I need to deliver downtown. So I ended up delivering downtown with a maternal fetal medicine specialist while with my cardiologist watching.
And so how was that when you had that conversation with them? How do you help them to understand the complexity of your disease? Let's start with you, Kestly, and then we can go back to you, Leslie, because I think this is really the root of what we're talking about a lot of times is how do we make that communication happen?
Right. Well, I just say, hey, I have tetralogy below, and I know that this is super high risk, and that you don't typically deliver with people who are like me, and I need to be downtown where if anything were to happen, I need to be with my doctors who know what to do and know about my heart.
And Leslie, how about you? Do you have any thoughts from that standpoint? Because obviously you have a lot of complexities that physicians have to deal with.
Yes. Actually, post Fontan revision, I asked if I was able to have a child. And so then I went through the process of seeing an OBGYN specialist. And at that point, I explained to the OBGYN specialist about my heart disease and the complexity of my heart disease. At that point, we did do some testing, and he said it was probably slim to none, no chance of me having any children. So, and at that point, I decided not to go through any further.
Yeah, that's a very, very hard conversation to have. I think that maybe Dr. Diampere, you can help us to understand when we go through sort of these sorts of situations with our patients, and our patients begin to encounter a very difficult diagnosis and a difficult new situation, such as in Leslie's situation, or even a very challenging situation as in Kestly's situation. How can we work with our patients as far as dealing with those stresses?
So thank you for asking that. I actually had a few suggestions that I wanted to propose and maybe share. There has been a lot of literature, of course, in children with congenital heart, and then some of the publications on adults growing up with chronic medical conditions, and realizing, I think the most important step for providers, or maybe for the patient to recognize as well, kind of this a stop moment, which both of you have done with your physicians, and saying, stop, let's reassess the situation. So realize the complexity of a situation, and being able to recognize the symptoms that might be contributing or additional stressors in life, and then rely on appropriate resources and utilize those resources to help the patient and help other physicians taking care of the patients. And I wanted to mention a little bit that every single patient, just it's such a pleasure for me to meet both of you, is an individual person. We've just happened to have this very complex congenital organization of blood vessels. And I think from that standpoint makes you a very unique individual, but your physicians have to recognize that and be able to really maximize the strengths of a family support. I can't emphasize enough, in our transplant evaluations, we work with a lot of social workers who really work with families to mitigate all these complexities of illnesses, and relying on family support and developing strategies to help improve the quality of life and really live the life that each of you as an individual patient desires to live. We're just here to help. And I think that's kind of my main message would be just realizing, recognizing the resources available and developing to work on that resilience training. I have a lot of admiration for patients with congenital heart disease and for your work, Dr. Lin, because it takes resilience to really go through that. So.
Yeah, I think that's a really fantastic point. I think maybe that's the first message we should probably take out of this is, right off the top, I think both Leslie and Kestly, both of you guys have an incredible amount of resilience, I think, and as do all of our patients with congenital heart disease. I think you guys really exemplify an incredible amount of resilience, and I think sometimes it's taken for granted, and I think sometimes when you walk into a doctor's office, people potentially put you into a box and sort of put you into a category and don't necessarily recognize that you come with this particular degree of resilience. But I wanted to sort of come back a second, because I think we do this show for two reasons. We do this show not only for patients and families, but we also do this show for providers who want to learn a little bit more about adults with congenital heart disease. And I think Dr. D'Ampere mentioned something very interesting and very important, and that is that we as providers also have to stop and consider the patient that's in front of us. So when we think about these patients who are very, very complicated and potentially moving towards end-stage heart disease, I think when we start thinking about them for pre-transplant, we often have to interact with many, many different healthcare providers, the patients do, and then we as physicians have to interact with many different healthcare providers that are within that patient's team. And so LiliRuth, when you start to coach our patients, because you have to work with a lot of these patients in the pre-transplant realm, how do you help them to understand how to advocate for themselves and to define that stop moment with their healthcare providers to sort of say, maybe we need to talk a little bit further about what's actually happening here before we take another step?
Yeah, absolutely. These patients, I will say, the congenital patients are very different from your standard heart failure patient. They come to us and they've been sick for their entire lives. They've been in so many doctors' offices and seen so many people, and we have to take a step back ourselves first and have a conversation about the entire body from head to toe. They're usually surprised at all of the different consults we send them to, because we are checking off every single box from head to toe. They're surprised that we find other things wrong that they may not have been diagnosed with yet. But the main thing is letting them know that the process is not black and white. There's usually a bump in the road, and we have to prepare them for that emotionally, especially. The decision to get to transplant especially is never black and white. It takes time, and they're so complex on top of their advanced heart failure. So
that's really, really great. Thank you. So yeah, I think one of the big things that you just mentioned that is so important is the concept of the head-to-toe patient. I think from our standpoint in congenital heart disease, especially congenital heart disease, we think of just the congenital heart lesion. And so sometimes we, in my field, have kind of blinders on, and we may miss the head-to-toe issues. So for example, the thyroid issues, the pregnancy issues, the liver issues, et cetera, et cetera. So Leslie, maybe you can tell us a little bit about your experience when you first started going down the journey of moving towards thinking about transplant. How did they approach you?
Well, actually, I approached my cardiac team and general physician. I saw signs because I've had other congenital heart friends go down the same road. So I started with my general physician and I said, hey, I'm having some issues. I'm becoming more tired, lethargic. I'm not eating. I'm not sleeping well. There's some things going wrong. I was retaining a lot of fluid. And then I talked to my adult congenital cardiologist, who was Dr. Toledo out of Tampa now. And so I said, maybe I should have a liver biopsy. I think it's about time. I'm pretty sure I'm on the road towards transplantation. The issue I was having, because I lived in Washington, D.C., they felt that there was a chance of me having a dual transplant, heart and liver transplant. And at that point, Washington Children's or National, they said that I possibly should go to a different hospital, such as Hub in Philadelphia and or Pittsburgh Children's or Presbyterian Hospital in Pittsburgh or Vanderbilt. So it was I had to make some rough decisions. I was still working full-time, 60 hours a week. I had to pick up and move 2 hours away in order to start the transplant process. There were a lot of emotions going around, anger, frustration, that I couldn't do it in DC. But not only that, I had to pick up everything and just start over again and go down that road of, oh crap, things are going south. And when I had the biopsy and then went a little bit further into getting an appointment with evaluation and going back to Pittsburgh itself was a huge tour for me because I had almost all my surgeries in Pittsburgh Children's. So to go back that area and the trauma from my childhood just brought everything back. A lot of procedures that I had friends that died there. And when I went through the evaluation, and I was actually inpatient 2 months prior to the transplant, I had a single ventricle patient right beside me across the hallway that was denied a transplant. And so I had to also go through the survivor's guilt, learning that my friend was going to die and I was in the process of having a transplant, and fighting tooth and nail with the cardiac team. This transplant's not just for me, it's for everybody, for the single ventricle community. I want them to know that if I go through the transplant, that they can go through the transplant as well, mentally, physically, emotionally, and psychologically. And I did everything I could and also helped some of the patients, single ventricle patients, throughout their course of the transplant journey. So it was very rough on me. Even in the cath labs, I came to some points where that I have a trauma from cardiac caths, and I have to, as a former educator, I explained to the transplant committee, I can't jump from part A to part D and go into that cath lab. You have to tell me every step like a baby, again, because that's so much stress on me. I remember all the casts, waking up from casts as a child. So the trauma going back into the hospital, going back to Pittsburgh, having my friends die, it was a lot to go through. And after the transplant committee realized, that, hey, let's slow down, let's listen to what she has to say, maybe we'll take a little bit from what her experience is, because I was the oldest single ventricle to successfully have a heart transplant at Presbyterian Hospital, and the third Fontan patient out of Pittsburgh Children's. So.
Thanks, Leslie. Dr. Giampera, maybe you can help us a little bit unpack that. You mentioned that you've noticed that looking at transplant in the adult congenital heart population here at Houston Methodist has been a little bit different. Can you tell us about how we can support patients as they're starting to begin this journey, like in Leslie's case, and specifically about the trauma that they experience and they relive when they start going through this process?
Well, first of all, thank you for sharing that story, a remarkable story that you are an example for many others. But I wanted to really maybe build on that a little bit. And so you were discussing a case of very complex post-traumatic stress disorder. And
yes.
That's how what LiliRuth you mentioned too, that patients, they're different in a way and they're not, but the way they're different from a mental health developmental level is that trauma that sometimes we tend to maybe forget or omit that because we breathe this. We are in this every single day. I mean, how many heart caths do you have to do? It becomes a routine to the point where we don't think about it. But the hospital environment is very invasive, especially for young children. They go through this with support of their families, with support of their physicians, and then they become adults and they stabilize. And then maybe there is a period of time where you don't have to have any surgical interventions. Then, as you mentioned in your case as well, there is this heart transplant. So it's re-experiencing of that trauma that frequently happens. And as medical providers, I think I witnessed it frequently. We do not put two and two together. And the way it demonstrates is increased mood reactivity, impaired sleep, maybe really acute anxiety, acute stress, or just not being able to go from A to D, slow down, again, stop, help me understand that. But it's a very complex post-traumatic stress disorder that almost can be dormant and then really reactivates with another invasive surgical intervention. So I think it's really important to see these symptoms of patients re-experiencing and then practicing avoidance. They're not really ready to jump into those heart caths. Having these negative thoughts and trauma-related experiences. Interestingly enough, one of the VA has developed one of the best post-traumatic stress disorder treatment strategies, and it's psychotherapy is a first line of treatment before even intervention with medications. But I think since we are speaking about how your providers can recognize it for the patients, I wanted to emphasize, remember that the person in front of you might have undergone very significant trauma during the childhood to the point that maybe they were told, you're not going to live as long as everyone else. Something bad is going to happen to you. It's feeling that at the time of stress, feeling that uncertainty. And I think when we as physicians recognize it, it changes the conversation to the point that I can understand and please tell me how I can be helpful. So I think that's a first step, maybe, and then considering mental health resources.
And in that case, some of the things that I asked them to do to help me with the process, such as liver biopsies or heart biopsies or cardiac cath, and going into the cardiac cath, can I have music in the background? Because Presby, I am not medicated for any of the cardiac caths now. I have music in the background. I've told friends that are single ventriculists going through the process that in some of the cases, the major concern and issues that they're having is the cardiac cath lab and going through those biopsies, heart biopsy, liver biopsy, and being in the cath lab because they have those traumatic experiences from the past and waking up in the cath lab restrained, especially in my age. I'm 48. Back in the 70s and 80s, it was very traumatic to wake up and there you are in the cath lab and you don't know where you are at 6 and 7, 8 years old. And then, of course, the doctors are sedating you or giving you medication to calm you down. But that trauma has made an impact on my life. And so having the music, having the same if possible, the same cardiac cath doctor in the lab has helped a great deal. And Presby has helped me as far as that, making sure that I have something there prepared, whether it be music or the same doctor, just to smooth things over.
Thanks, Leslie. Those are such really, really important tips. I think the other thing that you mentioned that I think has been very, very helpful is that you've become very much an advocate for other single ventricles. And it seems in our conversations that you've used social media to that advantage a lot and helped to really sort of bring people together from peer support groups. I want to turn to Kestly because I know you're involved in some of the peer support groups as well. Can you tell me a little bit about Zipper Sisters and how you guys support each other?
So Zipper Sisters is a group of women who are all born with congenital heart disease, and women post in it every day, and all about from our doctor's appointments to pregnancy to just life things. And through Zipper Sisters, we have been able to find other Zipper Sisters who live in our area and meet up. So I have met probably 50 women just in the Houston area who are all born with congenital heart disease just through that way. And most women have never met another woman like them. Like, let's say I had never met another woman with tetralogy of Fallot, but I'm lucky to have my twin sister who has tetralogy of Fallot. But I know for most women it's not like that. And it's just awesome to see how many women there are out there. And it's a very strong group and a close group.
So actually, let me dive into that a little bit. When you guys are together, Kestly, do you and your sister compare notes? I mean, do you talk about, well, how did this go with your doctor versus her doctor?
Yes, I will tell you, we talk about our hearts every day to each other just because I have her to talk to. And but yes, we tell each other everything. Every single doctor's visit. Up until my pregnancy, we actually did our doctor's visits together. We would do our echoes together, then we would sit down with the cardiologist together and talk about each twin.
That's incredible. And how do you guys think that that's helped you? Have you guys been able to compare notes and say, well, gee, I should do that, or you should do that, or et cetera, et cetera?
Yes. We're on different medications. Like, she takes propranolol, I take metoprolol. She always tells me, you may like propranolol and things like that. But yes, we do tell each other, even though we're a little different, we're both tetralogy of Fallot, but we're different because I have that extra defect. But we do compare everything. We tell each other everything. And I'm very blessed to have her in my life who has the same issues as me.
Yeah, I think that's an incredible amount of support that you can have from just having somebody that you grew up with who understands where you're coming from that standpoint. I guess when you guys, both Leslie and Kestly, when you guys think about this, how can we help other people with congenital heart disease begin to experience that same level of support? I mean, I think, Leslie, you've been through a lot at this point in time and sort of gathered people and resources around you to get that kind of support. But if you were to sort of talk to somebody who's just, say, growing up into their late teens and early 20s and sort of going out into the world on their own now without their parents at their side, how would you help them to begin to prepare for going out into the world that way?
Some of the things that I know I learned from experience is one of the doctors that I had, actually a physician out of near Austin, he's like, I think you're going to need your medical records. You really need to know your congenital heart disease, at least the names of them or the acronyms of them. So in case of emergency, you might want to consider a medical resume as well, just in case you're traveling. Have a list of your meds, your emergency contacts, your congenital heart disease, and possibly your surgeries as well, just in case there's something, there's a medical emergency where you're passed out alongside of the road and nobody knows exactly what's happening with you and your congenital heart disease. At least you have something in your vehicle or traveling along the road that if there is emergency that you have that. I think that was the best thing a general physician has ever let me know. And it helped greatly. I've used it along the way and told others about that as well. So.
I wanted to add, so there's been times let's say I'm like at the park with my son or something, and I'll turn around and I'll see a young girl with a scar down her chest. And usually you don't see that. And so I usually start by telling them, have you had open heart surgery? Were you born with a heart defect? And then I start to tell them to look into getting involved, because most of these people still haven't seen a cardiologist since their surgery. So I tell them to look up Zipper Sisters or look up their defect on Facebook and find a group. And that's usually how I tell younger people to get involved, or just start by learning your defects, like Leslie said.
And not only that, I was a former elementary teacher. I've been in IEPs where I was able to educate others in the education realm about congenital heart disease, and so that they are aware of the child in the room that has some difficulties. They might need extra time doing their work. They might need to go to the nurse's office to take their medication. They might need extra time as far as walking to and from a class and so forth. So I've been on several IEPs and educating others, teachers, medical professionals, and letting them know about congenital heart disease. I've also had the opportunity of working with children and showing my scar and explaining to them that they are able to do whatever they want to be in life, to motivate them and to become successful for whatever reason. If they want to be a doctor, they can be a doctor. If they want to be a scientist or a nurse, they have that ability. Just because you have a congenital heart disease doesn't mean that you're going to stop your life. Your life will go on. You do the best that you can and with what you have, and try your best. So.
That's really fantastic. So I want to turn it back to Dr. Dampere. I think you've mentioned a lot that we need to help our patients shore up their resources from a mental health standpoint. Mm-hmm. Can you help us to understand from a provider perspective, what are some of the resources we can offer to our patients when we start to see some of these issues start to creep up in terms of trauma, in terms of anxiety, depression, et cetera, et cetera?
So in the hospital, I wanted to get back to Leslie, that she really, it's small things. A lot of times we have music therapists, we have art therapists. Waking up in the heart cath alone, which with our adult patients seems like not a big deal. With a patient with congenital heart disease, we might need to adjust our team settings a little bit, that we do have that support, kind of extended family support that I think is essential for us to carry through their hospitalization and continued experiences. Because remember, this is it makes them stronger. They grew up with the heart disease since a young age and relied on that tremendous family support. And like we were discussing here with a twin sister, happened to have the similar condition, but that family support is really essential in being able to overcome the difficulties. I've met patients who have had severe panic attacks and anxiety after the cardiac cath. So I wonder if we can really listen and for the patient message, advocate as well, see what can be done. We do have music therapists, art therapists. We have our social workers on our psychiatry consultation team. We have a social worker that provides cognitive behavioral therapy, works collaboratively with other support staff to help ensure that patient is not alone, and we are aware that it's an invasive, difficult situation, and we address their pain adequately. So think through even IVs. Frequently can be very painful. and they don't have to be. So we have a lot of, again, asking the patient, how are you tolerating the pain, but then utilizing similar things that we utilize with children. Maybe the gel to relieve that pain, using, asking if IV placement has been painful for you, how can we make it better? So it doesn't take much time, but I think it really creates that experience of, I am not by myself, my team cares about me, and then we individualize the care plan for the patient going through the heart transplant in the hospital. With addition, as I mentioned, of psychotherapeutic intervention, and at times maybe using medications appropriately to help decrease that acute anxiety threshold at certain situations.
That's very, very helpful. And I think you mentioned something really interesting there. I thought this is where you were going, that, as providers, that we become part of the extended family.
Yes.
Maybe that is where you were going. So,
yes.
So I'm going to turn to LiliRuth, because I know she has a special power of working with some of our patients. I personally know that some of our patients will turn to LiliRuth with more trust than they do to us. So tell us how you do that. How do you create that bond, that relationship with these patients, such that they really trust you to the degree? Because I personally know that I've heard from multiple patients now that you are their first point of contact, that you are the person that they go to whenever there's a crisis, irrespective of whether it's a medical crisis or a social crisis.
It's true. I will say, as a transplant coordinator, we are way more than the title. We get to know these patients, their families, their children. I know where they work, I know where they live, I know what they like to do on the weekend when they feel good or when they don't. They have my cell phone number. They know they can call me if something's not right. They're going to be able to find me most of the time. And if they can't, I tell them a backup. But it's very important to get on a patient's level. I've been a patient myself. I think most of us have been, maybe more than others, but we're all just human, and being able to relate with them on a level that other people don't understand. The very special thing about our congenital patients is that they come in, and from the outside looking in, they don't look like a sick patient sometimes. And so just like Leslie, just like you were both talking about, you go to these physicians and they may put you in this box, but we know how sick you are. Some of the barriers that we also have as a transplant coordinator is that the transplant world is not fit to a congenital patient. So you may be sicker, but on paper, the numbers or the labs are not as bad as they need to be for us to get you a transplant. And so you're not as high on the list. You may wait longer. You may have a longer hospital stay. All of those things tie into that emotional need. We have patients that have stayed in the hospital for 9 months waiting on a transplant, 9 months in the same room, and we have to try to find ways to accommodate them. So some of these patients will call me and say, hey, I'm really struggling. So, it's our role. It doesn't matter if we're outside or in, to call and say, hey, can we move this patient to a room with a window? They need to see out. They need some sunshine. Or they may call and just say, hey, I need to talk. So I think it all just comes down to not, we take the badge off and the coat off, and we're just there for them from head to toe, like we talked about before. So
that's really great advice. I think so. One of the things I want to make sure I take away from this is that at the end of the day, it's a human and a human. And I think as healthcare providers, sometimes we get so busy, as Dr. Dampera mentioned, that we just do cath after cath after cath, or we see patient after patient after patient, that at the end of the day, we just have to take a step back and meet the person where they are and see them in the crisis that they're in, and help to restore that relationship and restore that bond, so that way they can reestablish that trust and have the sort of level of trust that our patients have with you. So to that end, there's actually a question coming from our online audience. Leslie or Kestly, were there any early signs that you might have brushed off in your experience in your lifetime?
Yeah, several. One of the things that I brushed off were arrhythmias. When I first had arrhythmias, I was working 2 jobs, about 60 hours a week. And at first I thought, I'm doing long hours, I'm taking college classes, and my heart rate's 110. And my friends noticed, hey, something's different, Leslie. You just seem a little bit more tired. Oh, I'm fine. I'm just working, and I'm okay. Until it got to a year later, and I ended up in the ER in Pittsburgh Children's Hospital with a heart rate of 260 beats per minute. And at that point, I was like, oh, I guess it was a little bit more than just the regular, I'm tired, doing long hours and so forth. It was a correlation of stress, having the Fontana, having, with arrhythmias, issues, and so forth. That was just one experience that I did brush off. The other experience was before the transplant, I had cognitive issues. Being an educator, some of the signs that I saw were I would talk, but I would skip words completely. And if I was writing, it was as if I was dyslexic. I would skip words, omit words. I kind of had like dysgraphia, which is a form of dyslexia. So one of the things, I was a kindergarten teacher, and I would say, instead of put your paper on the table, I would say put your paper on the floor, and the kids were like, what happened? So I would make a joke out of it. Oh, just seeing if you're listening. And it was a sign of heart failure.
Okay.
The other issue that I was having was I was retaining fluid. It was gradual to the point where I'm like craving salt, and I'm like gaining a little bit more and more. And in my abdomen, I looked like I was about 8 months pregnant at that point. And I just brushed it off. I can work a little longer. I can do these 2 jobs. I can be a teacher still. And my boss, both of my bosses, the first boss was like in the elementary, and she's like, yeah, no, take a day off. I was teaching college level English, second language, to doctors, lawyers, and so forth. And my boss was like, your room now is right next to my office. It's a little bit closer to the door in case you need to go to the restroom. And I have to keep an eye on you. And then to the point where I think we're going to cut down your hours, because I wasn't ready to go through that process. I knew that something was wrong. I knew that I was heading towards the transplant process. I had friends that had the same symptoms and went through the transplant, and some of them died, some of them lived, and the whole 9 yards. So I put it in the back of my mind and didn't want to really realize that something was really wrong.
Yeah, Kestly, I saw you nodding along that whole time. Tell us about your situations that you've sort of blown off.
Well, I'm being watched for my third open heart surgery, or third heart surgery, which will be open heart surgery. I'm actually have a lot of health anxiety, so I wouldn't be the same. I'm more like, oh, I'm feeling more palpitations than usual, so I messaged Dr. Duarte and asked her for a monitor, so I worry about it too much. But I don't think there's anything that I've missed yet, because everything's stable right now. I'm just being watched to see when I start getting out of breath and things like that more, for when y'all want to do the open heart surgery. But I was just, my twin sister with the tetralogy of Fallot is a teacher, so I could relate to what she was saying with my sister.
Yeah. So I'm sorry, go ahead.
One of the other things was that before, I was actually in the process of the transplant twice. One, right before the Fontan revision, I was living in Hawaii, went to California, Stanford, and I pretty much brushed off, having, everything's fine. I'm not going, my heart rate might be 180 beats per minute. Some of the issues I also brushed off was like having a stroke. I felt the signs of a stroke, my face, my left side being somewhat numb, and I would wait longer. And I saw the signs. My mother is a retired nurse, and she's like, well, why did you wait until I get home? You knew the signs. Why didn't you just go to the ER, or call an ambulance? But I chose not to. I made some mistakes, that could have cost me my life. And even then, to the point where when I had the Fontan, right before the Fontan revision, it came to the point my heart was stopping 6-second intervals of time. And Dr. John Lamberti, he's a cardiac surgeon, he told me, at this point, you can't be on the transplant list. It's either we do a revision or that's it, you won't last. So some of the mistakes I made may have cost me my life at that time, but I was a bit stubborn,
So there are a bunch of other questions here on the chat. So what is the most common sign to look for? So why don't we start with you, Kestly? What is the most common sign that makes you concerned? And I think you already told us there.
Yeah, I have a lot of PVCs. So whenever I start getting a lot, I get worried. But I do okay for now. I'm just being watched symptoms wise, and Dr. Duarte told me it'll be for shortness of breath whenever she wants to do my next open heart surgery done, because I need, I have tetralogy of Fallot, but I don't need my pulmonary valve replaced. I need muscle bundles removed in my RVOT. That's what I'm being watched for. So mine's a bit different.
Yeah. That's very helpful, yeah. And that would be probably the one that I would usually tell people, is that the shortness of breath that creeps up on you over time. So typically the thing that we often hear is, patients will tell me something like, well, 2 years ago I could run a marathon. Today I can barely run, a quarter of a mile. So that's worrisome to me. And I also don't want you to necessarily, or any of our listeners, to blow off palpitations. I mean, I think that that's something we still all take very seriously. Even in your situation, Kestly, we still take it very seriously whenever you tell us that you have palpitations. And I think because our concern is, of course, that it could, like in Leslie's case, be a sign of an arrhythmia. And so I think even if it was fine today, we still take it seriously tomorrow, because we when we're doing our jobs, right, as providers, we always take it seriously. And then another question that was brought up is a really good one. So how do you explain to an ER or another healthcare provider that you have issues, especially in a situation where it's a medical facility that you have not been to? So Leslie, do you want to take that one?
Sure. I was, like I said, I lived in Washington, D.C. I went into the ER room, and I knew that there was something wrong. I probably needed pacemaker change. And at the time, I was having symptoms. I was feeling lethargic and tired. And I told the ER doctor, I think it's my pacemaker. Could you please call my adult congenital cardiologist and run that by him? I believe it is the pacemaker that I need to have replaced. And he's like, no, we're going to do this and this. And I said, but I don't need that. I'm almost positive. I've had 2 pacemaker changes in the past. These are the same symptoms that I had running in the past. And I would really like you to at least run it by my adult congenital cardiologist, at least my symptoms, and if possible, do a pacemaker check to see, interrogate it, and so to see if it was that. And at that point, we both became irate and upset, because I'm very demanding. And so at that point, he's like, okay, I'm going to go and I'm going to get the interrogator and we'll see, And then after the results came back in, he came back in and he said, I apologize. You were correct. You will need a pacemaker within the next month or so, and I really apologize. I should have listened to your information that you had, the knowledge that you had, and the symptoms that you were having. And maybe it should have been a different way. And he apologized. So.
That's a really fantastic story. So another one of the questions that came up and is probably related to what you just said is, how easy are these symptoms to narrow down? Could it be confused with another condition? And I think both of you have now told us stories that really help to sort of bring us to that question. And the answer is absolutely. I think the problem that I think we as healthcare providers run into is we have a narrow lens in which we're looking at the patient, and we put them in a box with a certain diagnosis that we think is in our mind. And when we do that, we kind of lose perspective and don't have the ability to create what we in the medical field call a differential diagnosis that includes all the different potential problems that Leslie and Kestly, you all have mentioned. So we have probably time for this last question. And I really want to spend a little bit of time on this because I think, to Dr. D'Ampere's point, I think really finding those resources around you is really, really important to maintaining that resilience, especially because more than ever, I think we are all under a lot of stress. And I think in particular, our patients are experiencing a very stressful time. So the question is, how can someone like myself who has tetralogy of Fallot or other condition find a group like Zipper Sisters in my area? It's a rare condition that I hadn't heard a lot about. And of course, I think this applies not just to tetralogy of Fallot, but also to single ventricle pathology and other types of pathology and physiology and other types of lesions. I guess we'll start with you, Kestly, since you brought up Zipper Sisters.
Mm-hmm. So the question was, someone with tetralogy of Fallot or another defect wants to find people in their area?
Yeah, well, actually, maybe let's start with this. How did you find Zipper Sisters?
Oh, goodness. Facebook. I know. I through a tetralogy of Fallot group, and then a woman, she actually passed away now due to her tetralogy of Fallot, told my twin sister about it, and that's how we found it. So it was through a tetralogy of Fallot group, and then we were introduced to the Zipper Sisters.
And so this was on Facebook?
Yes, there's tetralogy of Fallot groups. It's mostly parents who go and they say, "Oh no, my baby was diagnosed with this," and then there's like all us adults who are just hanging out in it just because we joined it.
Well, I think they probably value. I'm going to guess that the parents value having the adults there, so that you can bring your perspective. Yes, they do, and I know of many parents now, and I've met many parents too, and I've even found two parents whose twins have tetralogy of Fallot. Wow. Both twins. So through Facebook, I say that's how you can find many people. You can search your specific defect just in the search bar for groups. That's really fantastic. That's great advice. And Leslie, how about you?
My experience started when the internet first started. I was on the very first Congenital Heart forum on the internet. It had the diagnosis, the cardiac surgeon, the place that you had the surgery, your age, your email. And then I went from there to, I need to find a group. Let's see if there's something on about single ventricles. And then I found Gooch, which was growing up with congenital heart disease out of England, and also ACHA, Adult Congenital Heart Association. And from there, I became the first, one of the first, I guess, possibly the first single ventricle to go to Capitol Hill and advocate on Capitol Hill in 2006 with the ACHA. From there, I took a break and took a back break, and then my adult congenital cardiologist said, well, you're going through the transplant process. Perhaps you might want to join a group again. And I said, Maybe not, but then I joined Conquering CHD. I was asked by a member of Pittsburgh Children's Hospital through a former Fontan friend of mine who passed away, and she was a pediatric cardiac nurse. They emailed me and asked me to go on their congenital heart page for Pittsburgh Children's Hospital. And not only that, I created my own, with Amanda, and we created a Fontan page for all single ventricles above the age 25 that are going through possibly the transplant process, possibly being denied, going through the whole process, from all the woes of single ventricles have. Not only that, I talk to people in my community. We do also Zooms for the Fontan community, and as well as in Conquering CHD, they do Zoom events where we talk to parents via Zoom and tell our story, as well as give them advice about life in general and how things may occur with their child. The other aspect that I do is I was on the Fontan Outcome page, and my story was on the Fontan page. I'm also, because I received a Hep C donor heart, I was asked by Health Union out of Philadelphia, Pennsylvania, to talk about congenital heart disease, and being an organ recipient of a Hep C donor, discuss my story there as well.
Wow, that's quite a story. I think the lesson that we've learned from this discussion is that despite all the craziness that's happening today on social media, that there are still some pretty amazing things that can be accomplished in the adult congenital heart field for our patients, and they can find a lot of support and a lot of really great friendships in this very difficult time through social media. So I think that's the first lesson that I would say that I think we can take away from tonight. I think the other major lesson that we can take away from tonight is that both of you have been really fantastic about being advocates for yourselves among your physicians, and that you've created that stop moment that all of you have mentioned is so critical to really ensuring your own safety, ensuring the safety of your future child, and that moment is something that we as providers also have to listen for when our patients are advocating for themselves, that we have to also stop and think about and listen to what our patients are talking about. And then finally, I think one of the things that we've talked a lot about tonight is also that both we as healthcare providers and our patients, we have to sit down for a second and listen to each other as human beings again, to really restore that bond and restore that relationship when things aren't necessarily flowing in that way. And when we do that, when we really recreate that bond, recreate that relationship, we can have an amazing friendship and an amazing relationship that supports each other through whatever difficult process that we're going to. Well, I want to thank all of my guests tonight. This has been a fantastic discussion. I think we've learned a tremendous amount from all of you, and I want to continue this conversation just like we talked about on social media. So if you missed any part of this evening's broadcast, please join us on YouTube again. This video will be posted, and you can also put your comments in on our Facebook page for DEBAKEY CV Education. And many of us are also on social media, so find us on social media and send us your questions and connect with us there. We look forward to having you join us next time around, and if you're interested in participating in events like these directly, either in the studio or via Zoom, you can join our Educational Advisory Board for Adult Congenital Heart Disease here at Houston Methodist. Thank you all for joining us, and have a wonderful evening.
Thank you.
Thank you.